A physician told me that exercise is his favorite medicine to prescribe because it has no side effects and it is so effective. Exercise can be used as medicine, provided that you have the proper intervention, which is usually a mix of cardiovascular resistance stretching and balance exercises, proper dosing or the intensity at which you work out, proper duration, frequency, how many times per week or day are you doing this, and then proper monitoring. Are you checking your blood pressure, your heart rate, your perceived exertion, and checking your feet for any ulcers or problems? A study in 2010 examined the benefits of aerobic training alone, resistance training alone, and a combination of both on H1C levels in people with type 2 diabetes. And the H1C levels are really your glucose levels or ratings over time. And gives you a better idea of how well you're controlling your glucose. Findings indicated significant improvements in H1C levels in the combined resistance and aerobic exercise group. Aerobic exercise improves insulin action, and they found that resistance exercise improves glucose uptake. So combining the two had a more beneficial effect overall on type 2 diabetes. My colleagues created this comprehensive exercise prescription program for metabolic syndrome patients. The program is generically modeled after cardiac rehab with increased initial monitoring, then tapering down sessions as responsibility is shifted more to the patient. The goal, ideally, is to start with a couple individualized sessions and then enroll them in a class with their peers. The evaluation consists of a number of things, taking basic measurements, height, weight, BMI, and doing general musculoskeletal screening just like you would in any other physical therapy office with range of motion, gait, strength, etc. We also do cardiovascular testing, balance testing, a neurological screen, and monofilament testing, which is pretty standard in people with type 2 diabetes. We also stress an education component, a large education component in this program, where we talk about goals and expectations and define a number of things so the patient understands what diabetes is, why we're doing what we're doing, and how this is all going to help in the long run. We're also going to introduce them to gym equipment if they're unfamiliar and initiate a home walking program. We use a walking program that is graded over time and is meant to be performed outside of the clinic or in addition to what is done in the clinic and at home. A case study was performed using this program, and the person here was a 55-year-old male with knee pain and diabetes. He had a sedentary job, had no exercise routine, and had poor nutritional habits. He also had significant bilateral neuropathy, which can lead to pain and numbness and tingling, and a number of other things, and had poor glucose control with daily sugars between 100 and 220, which is an enormous range. We also see at the bottom there that his H1C was 8.1, which is high. This is just a list of some of the medications. It's a long list, it's an expensive list, and just something to keep in mind. Here are some of the results of this case study, and these are just a couple generic measurements that we do in the clinic every day. And as you can see, the strength and balance improved dramatically over the course of the treatment. The previous slide looked at the improvement in function. This slide is looking at the more systemic improvements. As we can see, the H1C dropped. It's still a little high, but it is much better. The blood sugar stabilized right around 100, which is significantly better. Resting blood pressure decreased, and you can see especially the diastolic number dropped. We had improved resting heart rate, and the patient is now walking multiple times a week and doing resistance exercises at home a couple times a week. Hopefully all of the previous information has convinced you that this is a good program and worth getting started. So then the next question is, how do you get started, and will the insurance pay for it? The insurance will pay for physical therapy to treat this. In North Carolina, you do not need a doctor's referral to come see a physical therapist. We have direct access. So as soon as you decide you want to do this, you can come right in. My recommendation, because the pathology has so many different components, is that you do schedule a physician appointment and use the entire healthcare team at your disposal to control this and beat it, hopefully. A few things to keep in mind before you get started with this program. This is going to be hard work, but we're here to support you every step of the way. We promote an engaging and fun atmosphere here that is safe. It's normal to have a little increased pain or delayed onset muscle soreness for the first couple weeks of exercise, especially if you haven't been exercising in the past. And this decreases as your body gets used to the exercise. And please realize that weight loss is not typically seen immediately. This is a process that will happen over time. And finally, again, exercise is a beneficial medication to controlling or even preventing type 2 diabetes. Thank you very much for watching this presentation. We are very excited here at Specialized Physical Therapy to be offering this diabetes management program and look forward to helping you in the future.